Okay. All right. So today we're going to cover a little bit of the HA standard. Who has interest in going for their HA at some point?
Michaela's raising her hand.
2.5. 2.5. Okay, perfect. So there's a lot of information in the HA. A lot of it builds on what you guys have done before, but there's some, new things and some more in-depth things. So you guys have all heard me talk about insulin resistance and Cushing's disease, correct?
Yes.
You remember it. Perfect. So we'll go a little bit more in depth today. This covers 2 different portions of the HA standard. So the first part is under healthcare and veterinary knowledge. And the second part is under nutrition. We're going to roll both of those together since they cover the same diseases. So in the standard, it says, based on provided scenarios, discuss the following disorders and diseases to include anatomical system involved, causative agent, signs, and immediate care. So we're going to continue that topic throughout the winter and spring in some other lectures because there's a lot of diseases they cover. The first 2 diseases are a little bit different in terms of they're not infectious. I think we also have ulcers that, would be individually specific, but a lot of the other ones can be, transferable among horses. These ones are not. So we'll get started here with insulin resistance. Hopefully I can make my computer work. I have 2 computers and a phone. Okay. Slides changed for you guys? Yes?
Yes.
Okay. All right. So here's your classic insulin resistant pony horse. All right. Tell me some features you see in this horse. Fat. What else? Crickets.
Like sway back.
Okay. So I see a cresty neck. I see a sheath that's kind of hanging down. I see that it's a pony. I know it's a little hard to tell from a picture, but this looks much more to be pony built than horse built. So we certainly have some breed predisposition here. There are things you can't tell from the picture. What can't you tell that would be important?
We can't tell.
You can't tell? So we can't tell how old it is? All right, that can certainly be an indicator of disease. So the younger the horse, the less likely that they are to have some of these metabolic conditions. The older they are, the more likely those become. All right, so with insulin resistance, this is basically a reduction in the body's sensitivity to insulin. So who can tell me where insulin comes from? Anybody know what organ produces insulin in your body?
Lydia says the pancreas.
Excellent. Lydia is correct. It is the pancreas. Anybody know where the pancreas is located?
No.
By the stomach.
Excellent. So it is just past the stomach, located alongside the duodenum, or the first part of the small intestine. So you get out of the stomach, you end up in your duodenum, or your food ends up in your duodenum. And what does your food have in it?
Sugar.
Glucose.
Sugar, glucose. All right. So you see the glucose arrow. So the glucose is getting picked up from the diet. Your body says, oh, there's sugar. I need insulin. The insulin then takes that glucose and transports it into the cell. In horses with insulin resistance, basically that mechanism is disrupted. So we have the insulin produced by the pancreas, we have the glucose from the diet, but we cannot get it transported out of the bloodstream and into the cell. So that's basically where the disruption is occurring, is right at the cellular level. All right, so I often compare it to type 2 diabetes in people. A lot of people, especially older people, understand this condition quite well because it affects a lot of older people. Anybody know somebody who is a type 1 diabetic?
I do.
Excellent. If you guys remember Susanna Lake, she's a type 1 diabetic as well. All right, so she had a different condition than these horses have. Tell me what type 1 diabetics need. Anybody know what? It's also called juvenile diabetes. What do those people do?
They have to like check their blood level for insulin, don't they?
Get to check their blood sugar.
They check their blood sugars, but do you know what they do usually morning and night?
They get an insulin shot.
They get insulin. Excellent. So in type 1 diabetic, their pancreas is not functioning and not producing enough insulin. So type 1 diabetics need insulin. Type 2 diabetics have insulin, they just cannot, their body's not using it correctly. You understand the difference?
Yes.
Okay, I can't really see if you nod your head, so you have to like shout out. Thank you. All right, so type 2 diabetics. Anybody know a type 2 diabetic? These people tend to be, but not always, overweight. They tend to not exercise a lot. And they have no requirements for insulin, right? They're not giving themselves insulin shots, but they need to eat better, exercise better, and then sometimes take medications to help those cells respond to those insulin molecules. So very similar condition occurring in horses. So this is that same horse, a little bit different angle. You can really see the cresty neck here. All right, so very much a hallmark of this disease being overweight. All right, initially, as this disease progresses, it can start at any time. I have horses as young as 2 years of age, but more often it's a middle-aged horse that is having this problem. So the body really wants its blood sugar to be normal. All right, that's why humans check their blood sugar regularly. We want that level to be normal. As the insulin starts not working as well, the body says, oh, I have extra glucose, I need to get rid of it. The normal response is to make more insulin. Oh, I must not have enough insulin, I'll make more. So early on, the horse can compensate and just shoot out more insulin from its pancreas to help the glucose get into the cells. But over time, the cells become less and less responsive to that insulin, and the glucose levels in the blood continue to rise. That extra glucose becomes the problem. All right, so high blood sugar levels can lead to what in horses? Anybody know the most serious consequence of this disease?
Laminitis.
Laminitis, excellent. Whoa. All right. So what are these horses? How do we find them? They tend to be those easy keeper horses. All right. People who say they eat nothing. Our old halfling or nugget, certainly an easy keeper, right? She could eat a quarter flake of hay a day and stay fat. All right. These horses are obese, usually with a body condition score over 6. So 7, 8, 9 on the body condition score. All right. It can occur at any age. This says horses over 20, but I've seen it in all age groups, more often in your late teens, but certainly can happen younger if they're fat. All right. It happens more often in horses on high carb and high sugar diets. All right. So they tend to get fatter and have more issues. We certainly see breed disposition. So ponies of all varieties. Morgans, Arabians, and quarter horses are said to have a higher incidence of this disease. All right. And then we can see it in conjunction with Cushing's disease, which then gets confusing because now we have two different diseases that look very similar and we have to sort them out. All right. So we'll talk about Cushing's in a little bit. All right. So again, why do we care? This is our most serious reason for caring. All right. These horses tend to go on to develop laminitis, which can oftentimes not be reversible. All right. So looking at these horses, they tend to have a crusty neck. They have abnormal fat disposition. So they'll get a little bubble butt around their tail. They'll get fattiness behind their shoulders, which makes their saddle hard to fit. They'll sometimes even get this fat pad that looks like a donkey over their loin. You guys have all seen fat donkeys, right? They have those big kind of saddlebags on the side. We can see that in these really fat horses as well. All right. Many times these horses have muscle loss. So although they're fat, they can be skinny in other areas. All right. Weight loss or gain. That can be confusing, right? Why are they losing weight versus gaining weight? So typically early on in the disease, they get fat. As they start to decompensate, they can get skinny. And sometimes it's a matter of they're skinny over their ribs, but fat over these pocketed areas. So they can be a little bit deceiving. All right, lethargy. Most of the time, these ponies are not very athletic and they're tired all the time. They don't want to move forward. And that can just be from their metabolic disease. But certainly if they're developing some degree of laminitis, they tend to not want to move forward as well. All right, so how do we know? We get an idea based on looking at them, and then we know for sure by testing them. What are we testing? We're testing that insulin level. All right, so would their insulin level be high or low?
Hi.
High, excellent, right? We already said their pancreas is working just fine, and their body starts to overproduce that insulin to try to get the blood sugar into the cells and out of the bloodstream. So these ponies are going to present with a very high insulin level. All right. A single insulin level is oftentimes enough to diagnose a serious case. A more mild case, we sometimes need more dynamic testing. We won't get into the ins and outs of that, but oftentimes we'll give them Caro syrup, which is sugar, and then measure their glucose levels sequentially. So we do a little dynamic test of, okay, here's a baseline level. Here's what happens after you get a sugar load. This is how a normal body should respond, but your body's not responding correctly. So that can give us a little bit more information. And if we have a horse that's borderline, can be a little bit more of a sensitive test. All right, those tests take several hours, so we prefer to diagnose them just off an insulin level if we can. All right, treatment. Unfortunately, there was no one specific treatment. There is not a single drug that will fix this. It's not like a type 1 diabetic where we give them the insulin and they're better. These horses have the insulin and we're just missing the sensitivity of the cells to it. And so there are many, many different options for supplementing them. But the basis is always going to be diet and exercise. All right, so dietary management of these guys, we really need to eliminate pasture. As we all know, grass has high sugar levels, and we have no way of regulating how much they're getting. So if we cannot put them on a dry lot, then we recommend a grazing muzzle with a very small hole to eliminate as much of that grass aspect as we can. All right, low starch or low sugar hay. How do we know how much sugar is in our hay? How do you know how much sugar is in your hay?
What type of hay it is?
Okay, type of hay. What type of hay tends to have more sugar?
First cutting. I don't know, that's not the right type of hay, but
Anybody want to guess on type of hay? So we've got two big categories of hay, right?
Yes.
What are they?
Grass,
What's that?
grass hays and the.
Grass hays and legumes or alfalfa hay. Excellent. If we take grass hay and alfalfa hay, which one tends to have more sugar?
Grass hay.
Grass hay, excellent. Alfalfa hays tend to have more of what nutrient? Protein, excellent, good job. So our grass hays tend to have more sugars. How do you know how much sugar is in your hay? Have to remember the first question. Can you look at it and tell?
Probably not.
Okay, so what do you need to do?
Test it.
Test it. So you have it analyzed. I currently have 3 different patients that are going through this syndrome. All 3 of them have reached out to Nutrena, and Nutrena has done a hay test for them. So we now know exactly how much sugar is in their hay, and we know if they can stay on that hay or if we need to change to a different type of hay. If that's not an option, what can we do?
Okay.
Soak it. Excellent. So a minimum of 30 to 60 minutes to remove some sugars. Oftentimes we'll go up to 4 to 6 hours to help remove sugars. So it's kind of like soaking a tea bag. You put the hay in a bucket of water, a muck bucket, a water tub, and you soak it. The water turns a tea color. That water is now sugar water. What do we do with it?
We don't give it to the horse.
Excellent. We dump it out. Don't feed the. So I have people who don't quite understand the theory here. And then we just leave the wet soaking hay and the horse eats and drinks the hay and water. That's not helpful, right? So we need to discard, remove the water, sugar water, let that hay drip, and then feed it to them. They can be fed wet. We just want to eliminate as much of the sugars as possible. So if we're using warm water, it takes less time. If we're using cold water, it takes longer. In the summertime, we need to make sure it's not fermenting because it's getting too wet for too long. All right, we don't want to feed them bad feed. We just want to eliminate the sugars. If you soak it too long, you start to soak out other nutrients. All right. And we don't want that. We don't want to lose all of the nutritional value of the hay. We just want to try to get some of those sugars out. So this can be very beneficial if we don't know the kind of hay. So as we're waiting for a hay test to come back, or if I have a barn that constantly switches hay where testing doesn't really help you. If you're going to be getting a new batch of hay every month, testing the hay doesn't necessarily mean anything because by the time you get the hay test back, you're on to a new batch. Make sense?
Yes.
Excellent. So oftentimes we will switch them to an alfalfa-based hay if we have that option, or we'll soak their grass hay, or if we have a large batch, we'll test it to make sure we don't have to. Or some barns will have multiple types of hay, and we can take a test from each and decide which pile this horse gets fed from. All right. So that's our hay portion. I have a couple that don't have a lot of options that we've gone to all commercial hays. So they do make bagged forages that are low starch, or hay pellets, have a much more controlled sugar level in them. So a lot of those manufacturers like Stanley, where we get our pellets from, will tell you this bag of Timothy pellets has 13% starch. This bag of alfalfa has 10% sugars and starches. So then we know exactly what we're feeding. All right, so we've got options there. As far as grains, concentrates, treats, we want to eliminate as much of that as possible. There's so many grains on the market now that are marketed as low starch, low sugar. So we just need to make sure we're getting one that's actually low starch. So finding something that's less than 12% is ideal. So that can be a ration balancer, that can be a well-starved low starch, lots of different options out there. All right. We need a sign on these horses' door to say no treats. So no apples, no carrots. If they are going to use a treat, I'll use a diabetic candy. So just like for humans, if we're using a no sugar candy, we're okay. And they do make wafers and things like that now marketed to these horses. All right. So different options here on the market, like I said. Ration balancers like Enrich, Essential K, or Grow and Win. Purina makes several of these low starch options that are good for these guys, where the owner can still feel like they're feeding them something. They're still getting volume, but they're not getting the sugar and starch. Questions on diet?
Nope.
Okay. So moving on to exercise. All right. Exercise is the driver of metabolism. All right. So as we exercise, the body wants to put that glucose into the cells because the cells need that glucose to make the ATP to function. Right. We all remember science class. All right. So as that glucose goes into the cells, it can then get utilized. So exercise helps promote that. Typically, we're looking at 30 minutes, 5 to 6 times a week. All right. That can be hard for people, right? How many of you are actively exercising your horse this time of year for 5 to 6 times a week? All right. So that can be, new to the horse. So obviously it's something we have to do slowly. And certainly if they're actively laminitic, we can't be exercising them to that level. So we'll oftentimes start with hand walking, and then we'll bump it up to either lunging or long lining or riding, depending on the horse. But activity is key. All right, if those two things alone aren't enough, or if the horse is in a crisis situation, we'll come in with medication. All right. Thyro-L is probably our most common medication that we use. Basically, the goal here is to artificially boost their metabolism. All right. Their thyroid gland is just fine. There's nothing wrong with their thyroid, but we want more. And the way to make them produce more or have more is to give it to them. All right. So Thyro-L is the same metabolic boost that they get from exercising, but it's artificial. So we'll oftentimes start them at a very high dose of 48 milligrams or 4 teaspoons, and then we wean them down once they're losing weight. So our goal is that these horses get skinnier, but the levothyroxine medication actually helps with that transfer of the glucose into the cell. So it's helping that insulin do its job. All right, then there are many, many nutraceuticals out there. Nutraceuticals are basically things that are not FDA approved medications, but are supplements. Many of these are extrapolated from human drugs or knowledge of human metabolism. They do seem to work well in horses, but they're not overly extensively studied. So I don't always have numbers to say how long or how well it works, but if we measure insulin over time after being on these nutraceuticals, they do seem to lower insulin levels, meaning our sensitivity is increasing. All right, so chromium is one we get oftentimes compounded because the chromium pills from the human drugstore are very low milligram, and it takes a lot of them. So we'll oftentimes compound this into a powder. There are many supplements on the market as well that are pre-made. Some of them have chromium in them. Some of them we add additional chromium to them. Magnesium is another mineral that's helpful in increasing sensitivity, along with cinnamon, like regular old cinnamon. So different options for these guys on the market. Many times we're stacking these medications and drugs together, especially if the horse is actively foundering, that we need to try to reverse this process as quickly as we can. All right, so what's our prognosis? So prognosis for a plain old insulin resistant horse is good as long as we diagnose them early and we make all of our management changes. All right, the goal is diet and exercise. Once we get to the point of needing medications, or if we get to the point of being laminitic, then we're fighting a whole different battle. All right, so our laminitis can be our limiting factor here. All right, so you guys all remember how we score horses on our body fat scale. So finding these horses early, picking them out on an exam can be helpful. You know, I have owners that say, hey, look, this horse just looks different to me. And then we start investigating, you know, why is it cresty? Why is it losing top line? Why does it have these fat pads? And we can catch them before they get into a crisis. Any questions on how that works? All right, so the second disease they talk about is linked, basically. So equine metabolic syndrome is basically, I don't know why there's two sets of words on this slide. Sorry. Do you guys see two sets of words?
Yeah.
Yeah, okay. I'll fix that later. All right, so a horse with equine metabolic syndrome has three things wrong with it. One, it is insulin resistant. Two, it has a history of laminitis or is actively foundering. And three, it is fat. So it's a fat horse that has insulin resistance that is actively foundering, is said to have EMS or equine metabolic syndrome. All right, so you can have insulin resistance that's not affecting the horse, and those are the ones we want to catch early. The ones that we don't catch eventually typically turn into an EMS, and they basically are further down that pathway. So again, middle-aged horses tend to be our target here. Again, pony breeds, Mustangs, Passos, some of our Spanish breeds, Morgans and saddlebreds can be predisposed to true EMS. All right, so again, if we're testing these horses, what we're looking for is a high insulin level. There are other lab tests that we can do that we won't get into, like leptin and other markers of this disease that get a little bit more complicated. All right, so these horses can look very much like a Cushing's horse. So EMS and PPID are very similar. So oftentimes we need not just an insulin level, but also a Cushing's test to figure out which of these diseases the horse has, or if it has both. All right, so treatment of EMS. So all of the same dietary adjustments as seen with our insulin resistant horses, because they are. We need to focus on therapy for their laminitis, because these horses have laminitis as a hallmark of this disease. So that's going to be our primary focus. And then other options, in addition to what we've already discussed, we'll put them on vitamin E. All right. The goal there is it's an antioxidant and helps with free radicals and all of the things that happen with laminitis. And so we can add that into their other nutraceuticals that they're already getting. And then weight management and exercise, still very important. Again, we have to balance that with this horse being painful and sore on its feet. So that can be a little difficult. Any questions on EMS and how it relates to insulin resistance?
Oh,
Perfect. All right, so we'll move on to Cushing's disease. All right, so this is your classic Cushing's disease pony. What's the hallmark of this disease?
oh,
What is
it
he?
doesn't shed.
Doesn't shed. It has a long curly hair coat. Back in the day, that's how we diagnosed these guys. By the time they got to having a long curly hair coat, we knew for sure that they have Cushing's disease. All right, we didn't have great tests back then, and so we had to wait until they had long curly hair coats. All right, nowadays we've got better testing. We can catch them a lot earlier. They tend to go on to develop this long curly hair coat, even with treatment, but it certainly should be less and better controlled if we're catching them early and treating them early. But many of them will get hairier with time. All right, so Cushing's disease has a lot of different names you'll hear just to make it confusing. So Cushing syndrome, hyperadrenocorticism, PIPA, and PPID. The two most common terms we use are PPID and Cushing's. All right, so PPID refers to where the problem is happening. It's happening in the pituitary gland and specifically the pars intermedia. All right, so there's 3 separate parts to the pituitary gland. This one happens in the middle portion or the intermedia. All right, it is most commonly seen as an adenoma. Anybody know what that means?
Tumor.
Tumor, excellent. What kind of tumor?
A bad one.
I'll give you 2 options, benign or malignant.
Benign.
Benign, excellent. So this disease was typically called a benign tumor of the pituitary gland. Nowadays, some people think it's not really a tumor, but just an overproduction of hormone. Either way, the generic term tumor means growth. And so the pars intermedia is typically enlarged due to dysfunction. All right, so all of the terms apply. The more we know about this disease becomes the reason why they change its name so many times, because we're like, it's not exactly that, but you'll hear people refer to it as that. Where is the pituitary gland located?
At the bottom of the brain.
Excellent, the base of the brain. All right, so in order to get to the pituitary gland, anybody know how we would get there?
Through the mouth.
Through the roof of the mouth. So it's at the bottom of the brain. The bottom of the brain sits basically at the back of the throat. So if we wanted to get to it, we would have to go all the way to the back of their mouth, go through their palate, through their sinus to get to the base of their brain. All right, so not very easy to get to. Humans with pituitary surgeries, sometimes they will do an open oral surgery to get to it. All right, it's not something we've developed in horses, so there is no surgical option here. We cannot remove it, nor would we really want to, because there are portions of that pituitary gland that we still need. And because it's more of a dysfunction than a true tumor, there's no way to just cut it out. All right, so there's really no surgical option here. It is an endocrine or a hormonal disorder. All right, so the pituitary gland secretes hormones. In a normal horse, in a Cushing's horse, it is dysfunctional and shooting out too many of the wrong hormone. Make sense?
Yes.
More or less? Okay. All right. So this is certainly our most common hormone disorder in horses. All right. So this presentation is probably a little outdated because it says the youngest is 7 years. However, I have diagnosed it in a 3-year-old, 2 of them, in fact. So we can see it in very young horses as well, but our typical case is going to be that late teen. So as they get older, 13 and up, I start to think about it more. If they've made it to 25, then they're maybe a little less likely to develop it. But it is very common, to the point that 1/3 of old horses have Cushing's. So once we get to our, 25 and up category, 1/3 of those horses in that age group are going to have this. So it almost seems like an aging change in some of these guys versus a true tumor, which shouldn't affect that much of the population. But we do see it more common in ponies than horses. It doesn't matter if they're male or female, they can be equally affected. And really, we can see this in any breed. it probably diagnosed it in just about every breed we see. Certainly minis seem to be more predisposed, but we can see it in almost anything. All right, so again, that benign tumor or just hyperplasia, enlargement of the pituitary. So non-cancerous, it's not going to spread, it's not going to go anywhere else or affect anything, other organs in the horse. All right, what happens is that pituitary gland is releasing hormone, all right, without control. So these are just some of the hormones that it oversecretes. You do not need to know any of those. But those hormones go on to other parts of the body to then produce other hormones. All right. The hypothalamus is located also at the base of the brain, just behind the pituitary. Anybody know what the hypothalamus is for? What does that regulate in horses and humans? Any ideas?
No.
Okay. I think mine doesn't work very well because it works with temperature regulation. All right. So I'm always cold. So the hypothalamus in the horse has to do with temperature regulation, also has to do with their shedding patterns. All right. So some of the things we're going to talk about as to what's happening with these horses is actually related back to the hypothalamus and not necessarily the pituitary itself. But as that pituitary enlarges, it puts pressure on the hypothalamus, causing dysregulation of that organ as well. All right, so hypothalamus has to do with the thermoregulation, so sweating patterns and shedding patterns. All right, so what happens in these guys as that pituitary gland is overproducing all of those hormones listed on the other screen, those hormones go to another gland. All right, this gland is located at the kidneys. Anybody know what gland is associated with the kidneys that secretes hormones?
The adrenal glands.
Excellent, the adrenal gland. So the adrenal gland is the source of your cortisol or your steroid hormone. So there's nothing wrong with the adrenal gland, but it is being told to keep producing more cortisol. So it does. Cortisol then causes stress on the body. So if you're getting ready for a big test or a show, your cortisol levels are probably increasing. All right. How many of you get sick around test time? All right. As your body has that chronic cortisol level, it has trouble fighting infections, and you're more likely to get sick from normal things in the environment, viruses, whatnot. So that overproduction of stress hormones has lots of different effects on the body, including effects on their feet. All right. So it increases blood sugar levels. So you can start to get similar symptoms to insulin resistance. It suppresses the immune system. So you tend to have more illnesses, sicknesses, abscesses, diseases, things like that. All right. So all of those things here can be clinical signs. So there's not one single thing that we'll hang our hat on for this disease until they get really far along. All right. So initially we'll get a very subtle change in that shedding pattern. They're a little late to shed, or they start hairing up early. Eventually they'll get to that hirsutism, which is very long wavy hair coat. All right. Again, those horses have a much more advanced disease. In the early stages, sometimes it's just a color change. Sometimes it's a pattern change. So we get long guard hairs, but their, normal hair coat is fine. So those long guard hairs, typically under their chin or down the back of their legs, tend to get longer first. All right. Initially, these horses seem to have an increased appetite. All right. Those hormones say, hey, you're hungry, and you eat more. All right. Think about stress eating. All right. Increasing in drinking and urination happens as well. So these horses can drink large amounts of water, which then causes them to have a very wet stall. So oftentimes when I'm asking owners questions, they don't necessarily appreciate an increase in drinking. That may be because they have a automatic waterer, or because they have unlimited access when they're in turnout, but they may notice that they pee more or have a very wet stall. All right, these horses tend to be lethargic. They don't want to move forward. They don't want to do their work. They can become pot-bellied, so they get that look of a hay belly, even if they're in regular exercise. And then they start to lose muscle. Again, sometimes they're still fat, but they lose that top line or muscular build. All right, we can have horses that sweat excessively or sweat in weird patterns or sweat without exercise. That would all be a potential indicator. Crusty neck and abnormal fat distribution. Again, those mimic IR. So sometimes we can have one or both diseases contributing to those symptoms. And then our suppressed immune system will have delayed healing, will have infections. They're more likely to get respiratory diseases, more oftentimes get dental disease because they don't have that normal bacterial resistance that a healthy horse would have, more likely to have parasites. So what parasite do we typically only associate with young horses? Internal parasite, worm. You guys know what that one is? Somebody said ascarids? Yes.
Yes.
Okay, you're hard to hear. So ascarid. So if I see an ascarid in an adult horse, Cushing's is high on my list. All right. If that horse has lost its natural resistance to ascarids, I very much worry that this horse has Cushing's disease. All right. Chronic relapsing laminitis. All right. Certainly we'd like to catch this disease before we get to the laminitic point. But if we have a horse that has had multiple episodes, this is certainly something we're looking into. We're going to check its levels. All right. So again, when the pony looks like this, I probably don't need a test. All right. He's got the long curly hair coat. He's obviously laminitic. He's certainly geriatric. Those things all point towards Cushing. For a long time, we used the dexamethasone suppression test, where we would basically give them a drug to slow down that pituitary gland, and then we'd test their levels later. 19 hours later, to be exact. We no longer use that test because one, we have to give them a steroid, so it can increase their it can cause a bout of laminitis if they're susceptible. So we try not to use that test anymore if we don't have to. And now we just typically do resting ACTH levels. If we have a horse that's borderline, we can do what we call a stim test. So again, one of those dynamic tests where we take a baseline, give them TRH, and then check again later. The urine test isn't very accurate, so we really don't use that. All right, so this is the old way of doing it, is a suppression test. I haven't used this test in probably 10 years. Now that we have the ability to do a single level measurement or a dynamic test. So this test only takes 10 minutes, so it's not too hard to do on a farm call. So we do a baseline, we give them TRH, and then we draw their ACTH level later. This gives us a little more idea of what that pituitary gland is doing in response to stimulation. All right. So unfortunately with these guys, there is no cure. There's no way to get rid of that pituitary adenoma. Our goal is to reduce the hormones that it's releasing. And that way it's no longer stimulating the adrenal gland to produce more hormones. Our goal is that we get a reduction in our clinical signs and we don't get the complications such as laminitis. All right. So there's only so much we can do medically. We also have to make sure we're making all of those management changes. So treatment-wise, drug of choice is Pergolide. Pergolide, typically they're going to go on a pill per day. Again, sometimes dependent on the horse, but there are some other medications on the market, but Pergolide is certainly our best choice. All right, medication is lifelong. These ponies are going to be treated forever because there's no way to get rid of the disease itself. All right, so this is the drug that's currently available. It's called Presend. Active ingredient is Pergolide. It is a dopamine agonist. So our dopamine controls the release of ACTH, which was the hormone we were measuring in the blood. And that ACTH is what's controlling the release of cortisol. So if we give them this dopamine agonist, it says stop producing ACTH. And if they don't have ACTH, they're not producing excessive cortisol. Does that make sense?
Yep.
Yes. All right. So what are our management things? So certainly routine veterinary care and supportive care of these guys. That may be clipping their hair coat so they're not sweating, so they're not getting skin infections, making sure we're keeping up with their feet, looking for any subtle signs of laminitis, making sure that we're keeping them as healthy as possible. So if they are immune suppressed at all from this disease, we want to make sure we're doing what we can to bolster their immune system. So that would be routine vaccinations to make sure that they're able to fight those off. Certainly dental care to make sure that we're looking for any tooth infections, problems there. Certainly if they do have an infection, they are much more likely to be reliant on antibiotics versus fighting it off themselves. A young, healthy horse can fight off small infections. These guys tend to get more severe infections with, smaller loads. So all of that becomes our supportive care for these guys. All right, dietary management, very similar to our IR horses, that we want a reduced carb intake. We want to make sure that diet is balanced, though. We don't just want to put them on soaked hay and nothing else. We need to make sure they're still getting all of their essential amino acids and vitamins and minerals. So a ration balancer, a low starch formula, even an equine senior can be good for these guys. They don't necessarily have IR. So we just want to make sure we're not overloading them with carbs, but they don't need to be as tightly restricted as if they had IR. All right. So this says well-managed horses live an average of 5 to 7 years. So remember, most of these horses are old to begin with. I've had several horses that live 10 years or more on Pergolide. And that's just a matter of how well they're managed and how old they are when they start their disease. If they're already 25 when they start their disease, then another 5 years is pretty darn good and they're 30. All right, anything that's poorly managed or advanced cases typically will succumb to a bout of recurrent laminitis where we just can't seem to turn them around, or a severe infection, most likely pneumonia or things like that. All right, certainly very large tumors or adenomas can cause blindness because of pressure on the optic nerve if that pituitary gland gets big enough, or seizures if it's pushing on the base of the brain. Both of these are very, very rare. Questions on any of that?
No.
All right. So this just goes a little bit into laminitis, which you guys all have talked about before. So obviously in these cases, carb overload becomes internal. So it's not that they got into grain, but that they have too much circulating blood sugar, which is the same thing that happens with a grain overload. All right. So basically divergence of that coffin bone from the hoof wall, or sinking of that coffin bone within the hoof, causing tearing of the lamina and pain, swelling, all of that. All right, so this is a picture of your lamina. So you're sensitive and you're insensitive. You get swelling in there and it's like the Velcro pulling away. All right, so this is a normal looking hoof here. So your coffin bone is parallel to that hoof wall and very well attached. This is your laminitic horse that has tearing and divergence or rotation of that coffin bone away from the hoof wall. What structure is causing the rotation after the damage is done?
Deep digital flexor tendon.
Deep digital flexor tendon, excellent, because it inserts where?
Back.
Back to the coffin bone.
The bottom of the coffin bone, excellent. So it's attaching down to the base of the coffin bone and it keeps pulling because that's its job, and it has nothing pulling against it because the lamina are damaged. So it pulls that bone backwards and downwards. All right. So we can certainly have mild, moderate, and severe cases. They all can be extremely painful. And our x-rays are going to help us decide how long this has been going on for, how severe it is. All right. You guys have all talked about what a laminitic horse looks like. You know, our biggest thing is that they're shifting their weight backwards. They're painful. Most of the time, this is occurring in the front feet. I have had several cases of IR and Cushing's horses that will founder in all 4 feet because that is a systemic disease causing damage in all feet at once. All right, those are our x-rays looking for how bad the damage is. All right, so laminitis treatment in and of itself certainly requires a good farrier along with good medications. There's lots of things that we'll use to treat the laminitis itself, but we've got to back up and make sure we're treating the inciting cause being Cushing's or insulin resistance in these cases. All right, questions on any of that? All right, now that you're information overloaded, you guys are free to go.
Thank you.